tuned in to Metro Focus. Inspiring talk news for you.
Hello and welcome to Metro Focus. Today we have on the show with us Eric Lintala. He is a certified health consultant and is a certified instructor for the New York State Exchanges. Eric has over 25 years of experience working with employer groups, explaining how health insurance coverage works, and today he's going to tell us what we need to know about the ever-changing health insurance industry. Hi Eric, thanks for coming on the show.
Hi Melissa, thank you for having me here tonight.
So Eric, you work for Beltz-Ianni Associates?
Yes, we're administrators and insurance brokers in Rochester and Buffalo.
Okay, so you came in today to talk to us about the Obamacare, also known as the Affordable Care Act / healthcare reform, also known as the exchanges. So what exactly is all of that?
Okay, well, people are aware that there was a new law in 2010 which changed all of healthcare. They created exchanges where individuals can buy insurance where they could not buy it affordably before, where small businesses can buy their insurance and qualify for tax credits, and that companies must provide health insurance and employees must have it if it's affordable, but there's a whole series of rules that fall around those regulations that make it possible for people to buy affordable health insurance.
Okay, now when we spoke on the phone yesterday, you gave me some really startling statistics with regards to the number of uninsured Americans. Can you tell our viewers some of that information that you gave me yesterday with regards to 18% of Americans
Well, that's
I'm sorry.
Yeah, that's why they made the law changes, because we had almost 18% of Americans didn't have health insurance, and that was right here in Western New York, by the way. People don't have health insurance, and I saw a statistic that last year when they were first starting the exchanges, there were over 65,000 people without health insurance just in Genesee and Orleans counties. So they didn't have access to it, they didn't know how to get it, and they're looking for help. And that's what the regulations, the laws, Obamacare does for them. Okay,
so there are several components with regards to the Affordable Care Act and who it impacts. So first, if you could please talk about the individual.
Okay, the individuals are now able to buy health insurance either on the exchange, it's called NY State of Health, or off the exchange directly through the insurance companies.
And an individual is someone who's purchasing insurance directly from either the New York State of Health website or an insurance carrier? Correct. Okay, so they necessarily don't have to have coverage through an employer?
Correct. As a matter of fact, they would, by buying through the exchange, they can get tax credits to make it more affordable, or if they don't qualify for the tax credits, they can go right to the insurance company and buy it directly.
What helpful information is there out there, or that you know of, that these individuals need to hear about? I know you mentioned tax credits and laws. I know there are subsidies available, but I also know that there are penalties for individuals who do not have health insurance.
Okay, well maybe we'll start at the penalties. We'll start with the bad news and go to the good news.
Okay.
As of this year, 2014, there is a penalty if you do not have health insurance, and it's $95 an adult in your household, and half of that, $47.50 for each child. $95 does not sound like a lot of money. However, it's $95 or 1% of your income, whichever is higher. So if you make $20,000, the penalty is $200. Not $95. And next year, for 2015, the penalty becomes 2%. So that would be $400 on someone making $20,000. And after that, it's 2.5% going forward. So all of a sudden, that's another $200 that you have to have in April when you pay your taxes, if you don't have health insurance.
So these individuals who are not insured currently in 2014, when they file their taxes, they may be hit with this penalty.
Correct, and they might not even be aware of it. So they're going to get a 1% of their income additional penalty added onto their tax bill in April.
Wow.
And then it'll be too late for the open enrollment to buy their health insurance for 2015. So unless they figure out how to buy insurance, they're going to get hit with a 2% penalty the next year.
Well, let's talk about that open enrollment right now, because I'm sure now individuals are watching and their antennas are going up, because nobody wants to be hit with a penalty at tax time for something that they really didn't understand or know about. Okay, so if you could talk about that.
Okay, so the open enrollment has started right now. It goes November 1st through February 15th of 2015 for individuals to buy health insurance. And in that time period, they can buy it on the exchange or directly from the insurance company. If they buy it on the exchange, depending on their income, they may qualify for a federal tax credit that makes their insurance more affordable. And that's where the numbers get, I think, confusing for people, because they're all set in a percentage of the federal poverty level. But for instance, you can get a tax credit up to 400% of the federal poverty level, which means 4 times the federal poverty level, which means an individual could be making $45,000 a year and still qualify for a tax credit to help them pay for their health insurance. If you look at all family household sizes, in New York State, 64% of households would qualify for a tax credit to help them buy insurance if they didn't have employer-based health insurance. So when we do this, it allows you to come in, say, okay, this is what I'm earning, this is the insurance that I need, and then we match the insurance with your income, how many children you have, how many people in your household, and your cost is only dependent upon how many people in your household and how much income is in your household. And then it sets up, you would pay at $23,000 a year, roughly, you'd pay $125 a month for insurance.
Is that for your entire family, for the most part?
If at 100, it probably would be, I have my statistics, but it would be close to that for a family. The income is based on the total parents' income and the kids' income as a household. In that situation at $125 or $150 a month, usually that would be a situation where, say, there's a single mom, she gets her insurance for $125 a month, and then the 2 kids can participate in Child Health Plus, which has no deductibles, has no co-pays, and may end up costing as little as $9 a month for the kids. So there's 2 or 3 different programs that come together through the exchanges that make insurance affordable for the whole family.
So based on this law, everyone in New York State, everyone in the country should have some form of health insurance?
Yes, they should. And I work with people constantly say, oh, I can't afford it. But then you start looking at it, well, maybe I can't afford not to have the insurance. Because it's not just the penalty, it's that we don't know when we're going to get hit with a big bill. And we know the cost of insurance, cost of care is so expensive. Plus, you automatically get paid in full annual physical exams, you get annual OBGYN exams, you get the flu shot covered. So, I mean, you do have some baseline benefits. And then there is a second set of subsidies which decreases your deductible. So that means if a standard plan has a $2,000 annual deductible, if your income is lower than the median income, than the average income, then instead of $2,000, you have $1,750. If your income is the next stage below that, it's $250 deductible, and lower than that, there's no deductible.
So it sounds like there are policies out there, some forms of coverage that everyone could possibly look into or that would suit everyone's needs. When we come back, we'll talk about the other aspects and impacts of this law. Stay tuned.
Metro Focus.
You should wear a tie.
Dad, nobody wears ties to school.
Tie says you're serious. It'll make a good impression. And remember, you're there to study,
to learn, and to make something of myself. I got it.
Almost half of all UNCF students are the first in their family to go to college.
They have some great architecture classes.
Dad, I'm not really interested in architecture.
Well, keep your options open. And remember, no girls until
my work is done.
And I'd make sure that I got my lunch.
Dad, you're not going. I am.
I know.
Listen, we better get going. Don't want to be late the first day in.
Oh, yeah.
And when you're the first to go, you're going for a lot of people. The United Negro College Fund. A mind is a terrible thing to waste.
I don't want to give you mine.
passenger side of his best friend's ride, trying to holler at me. Hanging on the passenger side of his best friend's ride, trying to holler.
Mom, Dad, we need to talk. I think it's time you learn the facts about discrimination. I heard what you guys were saying about how the people next door don't belong here. You trying to keep people out of this neighborhood just because they're different is so embarrassing. Besides, it could be illegal. And did you ever think about how they must feel? From now on, please remember that everyone has the same right to choose where to live as you did. I think that went well. Isn't it time you talk to your parents about discrimination? After all, fair housing begins at home.
These kids are in trouble. They're not getting high on drugs or stealing. If they were, you'd do something about it right now. But why is it almost half of all parents who suspect their child has a problem learning wait a year or more before getting help? Why? Kids with learning disabilities are smart. They just learn differently. Call now. The sooner you get help, the better the chance your kid has.
I can listen.
I can cook.
I can coach.
Kids with something to do are less likely to do drugs.
I can drive.
I can paint.
I can dance.
A little of your time can make a lifetime of difference.
I can read. I can help.
You can help. Call toll-free 1-877-KIDS-313 to find out about community drug prevention programs.
I can keep a kid off drugs.
Welcome back to Metro Focus. I have with me Eric Lintala, who is telling us about all the helpful information with regards to the Affordable Care Act and how individuals can get insurance. And now I'd like for you to talk about the impacts of the Affordable Care Act with individuals on Medicare.
Well, Melissa, you always ask the hard question. Okay. Well, we thought that Medicare wasn't going to be affected under the Affordable Care Act, but all insurance is affected.
Okay, well, let's tell the viewers first what Medicare is.
All right. Medicare is the program for seniors, which means people over 65, and for disabled Americans who qualify under Social Security. So
Okay.
And those programs are divided into three components. Part A, which is roughly your hospital component with deductibles. Part B, which is the medical services, surgical services, things of that nature. Part C, which we know particularly in Western New York, is Medicare Advantage plans, so like HMOs for Medicare eligibles. And then Part D, which is the drug benefit component of it. Those pieces come together to provide Medicare healthcare services for people. With the addition to Part A and Part B, you also have Medicare supplemental policies, which pay the deductibles or co-insurances or other services that are not covered by the Medicare plan.
Right, okay, so how does the Affordable Care Act impact those individuals? Because initially, like you said, we thought there would be no impact, but can you tell our viewers what we've since found out?
Well, what's happened, it's all about the financing portion of it. It's not about the coverages of it. It's about how you pay for the services and how are the physicians and hospitals reimbursed.
Okay.
So the big point is that in Western New York, we've had some very good Medicare Advantage plans, which seniors have signed up for and have had very good coverage at the local doctors and hospitals for $20, $30, $50 a month. Now, and in those plans, you gave your Part A and B benefits to the insurance company, and they covered you like you were covered under an HMO. Now, the insurance company is being reimbursed from Medicare for the people who are signed up. Under the health reform, there's lower reimbursements to the insurance companies, so they have to raise the rates on their Medicare Advantage plans, and they take away some of the benefits because they have to justify the costs versus the money that they're bringing in. And as you look at Rochester, Buffalo, Syracuse, looking at all of Western New York, some of those Medicare Advantage plans have been the most profitable areas for insurance companies, and now it's getting squeezed down. So that's the real change. But you know, it's very important because right now, baby boomers are starting to turn 65, and there are 10,000 baby boomers every day turning 65 for the next 17 years. And some of them live in Western New York. So they really need to understand what's going on and how to make their healthcare dollars go farther.
Absolutely. So what should a senior consider when looking to select a healthcare provider or coverage?
Well, they always say don't always look at the premiums, the dollars, but we all look at the money first. So we always look at the money. And then you look at the companies. There's several very good local health insurance companies in Western New York or in Rochester. That's fine, but you also have to step back and say, wait a minute, what are the networks of providers in there? What are the doctors and the hospitals covered? Are my prescriptions, are my meds covered? And then it's what happens if I go outside of the area? Now, going outside of the area might be spending 3 months a year in Florida. It might be traveling because now you're retired and you have time to travel. It could be that you have a child who goes to college. Well, I'll take that back. The college child, we're going to put them on the health exchange. So we'll put them aside. They're not going to be part of your Medicare plan. But it's going to be more for you and your spouse, or how do you get your coverage delivered to you? And then it's what is the premium? Because there are a couple national plans that are very affordable, and some of which have no premiums. Then we also have, if you don't use your health insurance and you're a senior, because some of us are pretty healthy as we're hitting 65 or 70, you can buy a high deductible plan that gives you a medical savings account. So you have a $4,900 deductible, but you turn around and Medicare gives you $3,200 a year onto a debit card to spend for your health costs. And if you don't use it, you keep it. So when you're healthy, you can save up money. You can almost bank it against future years when you need more money to cover your costs.
And that rolls over.
Every year. It rolls over every year. So that's what we've been talking to employers about high deductible health plans, but it's actually out there for seniors. So when you look at the other things for someone who's looking at their Medicare plans, it becomes very personal. We're constantly seeing people said, why did you buy this policy? And they say, well, because all my friends do.
Yes.
And it's almost like they go with the herd. And that's fine, but the reality is each of us are very different, both in our health claim needs, our medical status, where our kids live, where are we going to go to visit, where are we going to spend our time doing. So, and unfortunately, it's all too common. We have a friend whose mother just got a rare form of cancer. She has to go to Sloan Kettering in New York. Her plan doesn't cover it. So here it is, we're coming on November. Does she wait 2 months before she has and changes her plan to get Sloan Kettering in network or not? So it turns out there's a lot more decisions that people make, and it's very hard for seniors because you're set in your ways, or you're more set in your ways. And you have to look at these things, maybe not every year, but you should be paying a lot of attention to it.
Now, I know that there are some important dates for Medicare individuals as well for open enrollment. When are those dates? What should?
Well, we're right in the middle. We're right in the open enrollment season, and just like the individual exchange, they're going until December for open enrollment for January effectives. There are also special enrollment periods. If you're just turning 65, you would contact the Social Security Administration, SSA, 60 to 90 days before your birthday, so you could set up to be on Part A, it's automatic, and then signing up for Part B, which you have to pay for. A side note, Part B premiums are not going up this year, so it was $104.90. It's going to stay that way. Something that people don't know about that is if your income is higher, you actually pay more for your premiums under Part B. So the more you make, the more you pay. And while that may be fair, it's something that surprises people because nobody wants to pay more for insurance.
Absolutely. And they could call 1-800-Medicare.
Exactly.
Right?
Yep.
Okay.
And so that's one of the open enrollment periods when you're turning 65. But if you're on an employer plan and you retire, that's a special enrollment period. So you can actually leave the employer plan and sign up for Medicare and join a Medicare Advantage or supplemental policy because you come off of an employer plan. So people have more options than they know.
Thank you. When we come back, we will talk about how the Affordable Care Act affects and impacts our small employers, our small group employers.
Can you tell which of these children was not born free? Can you tell which of these children was not born equal? Can you tell which of these children does not deserve to be treated with dignity? We can't either. human right number one. We are all born free and equal. What are human rights? Find out at youthforhumanrights.org.
This used to be a good neighborhood. Now it's a mess. You got all these polyps running around. Speaking of the devil.
Colon cancer almost always starts with the polyp. Get the polyp early and stop colon cancer before it even starts.
Where'd you think you were running to, huh?
I didn't even see you guys there.
Get the test, get the polyp,
I want to talk to my lawyer!
get the cure.
I got a phone call!
Properly inflating my tires burns less fuel and saves me money on gas. Yeah, I'm saving Mother Nature from pollution, but more importantly, she saved me $11. Ow!
Environmental defense. Get green.
By keeping my car regularly tuned, I save money on gas and repairs. That also means cleaner air. You know, feels good to help save the cash, planet.
Environmental defense. Get green. For more tips, go to getgreen.com.
Welcome back to Metro Focus. I have Eric Lintala here, and he's going to talk to small businesses with regards to the Affordable Care Act and what you need to know. Eric, I am just so thankful for all the information that you have spewed out to our viewers and to me, because a lot of these things, this information I did not know. So thank you so much. But what would you like to tell our small businesses, our small business owners?
Well, Melissa, the small businesses are the key to the whole health system right now, because small businesses, there are groups with less than 50 employees, make up over 96% of our employers. And when you include groups up to 100 employees, you're talking about over 55% of the employees. People who work in this country work for small businesses. And the Affordable Care Act, Obamacare, has created a set of rules that they now know what the game is. Because right before then, the insurance company was able to say you can have one plan or you can have two plans. You have to buy this plan or you have to buy that plan. Now, under the Affordable Care Act, or the New York State of Health program, and for small businesses called SHOP, Small Business Health Options Program, but the B is silent. But under the SHOP, the employer can offer benefits or not offer benefits. They don't have to pay for it, or they can pay for it. They can offer more than one insurance company with more than one level of plan. So you could literally have a business with 20 employees in Buffalo offering 50 different policies to its people to choose from. Wow. Now, 50 might be too many, right, but the employer can say, I know what my people earn, I know what they need, I can structure a plan and that's affordable to them, but I can also say I can have different benefit packages for different levels of my management. So I could have one package for owners, one for managers, one for supervisors, one for staff employees. At first glance, we might say, well, that doesn't sound fair. Actually, it could be better than fair, because if you're making less than $12.50 an hour under the rules, it might be better if your employer doesn't offer you insurance or not make it affordable, and you go on the individual exchange and get a better deal. You can get richer benefits for less money than you can buying into the employer plan. And I'll use an example. Our plan, we cover the single premium almost in full, but I have a family. So I get to pay $600 a month for my family coverage. That's $7,200 a year that I pay for health insurance. All for that, I have a $5,000 deductible. So I have to pay $12,200 before the insurance pays for anything other than an annual exam and a flu shot. Why does that not sound fair? And that's what's being done. And I'm in a situation where I actually can put money into a health savings account, which is like an IRA for healthcare expenses. So because I have a high deductible plan, I can put up to $6,500 a year into an account if I have it.
Tax-free dollars.
Tax-free dollars, okay. No tax when I spend it, and it rolls over tax-free for as long as I'm alive, my wife is alive, and for my kids. So, but not everybody can do that. And so this is what's going on. So what is affordable might not be really doable for families. And families see this, and what we see now is when people are given the option, they're considering buying up to copay plans. They don't want the high deductibles. They want to just go in and pay $40 at the doctor, not the first $2,000 or whatever. So really people have to shop more closely, and it works better through the employer in a lot of situations because it's all pre-tax payroll deduction. And so that's the part that people don't understand. So the employer now is the place for people to design what a plan looks like, because it could be different for different people in the shop. I mean, I was working with a group today with 8 employees. Well, of those 8 employees, we're going to have people on 5 different health insurance policies. Some have contributions, some don't have contributions, some are on the individual exchange, all from one employer. So everybody has a different deal.
Wow.
And you know, the employer says, well, I can't do that. Well, actually they can, and it's very doable. They just need to work with an advisor who can help walk them through the rules. Because once you know the rules, it doesn't matter if your people participate or don't. You can make an offer and nobody could buy. That's fine. And then you get billed for all the plans, showing what's on the employer responsibility and the individual responsibility. They get one bill, paid monthly, and really it's a pretty straightforward way to buy insurance. And I'm pretty much believing that over the next 3 to 5 years, the employers are going to be moving more and more on the shop, because not only do they get the ability to buy multiple policies and take care of individuals, but they also qualify for a small business tax credit. That group today of 7 or 8 employees, 2 of them don't count because they bought on the individual exchange, but the employer gets a tax credit for what they contribute for the employees, which could be up to 50% of what the employer is paying. And it's not a tax deduction, it's actually a check from the IRS when they file their taxes. So there's a lot of things going on for employers that they're not aware of, and they're constantly saying, well, how come nobody's told me about this, or I don't like Obamacare, or I don't want the government telling me what to do. Well, is it better to have the insurance company tell you what to do? I mean, we need them, and they're a very good service, and we have some of the best in the country right here in Western New York, but they still have their rules to manage their business, and they're not always the rules that the employer has to play by to manage the employer's business. So the employer is the key. How do we help your employees get better health insurance and be able to afford it?
That's awesome. Now, for individuals who don't know where to find these resources, can you tell them where, because you referenced the New York State of Health, you referenced the shop, can you tell our viewers where they can find this information?
Sure, Melissa. The first place to start is through the New York State of Health, which is the Individual and Small Business Exchange, and their website is www.nystateofhealth.ny.gov. And you can call them toll free. They have actually a very well-informed customer service staff at 1-855-355-5777. I have talked to them a number of times. They will get you your answer. You can contact me if that would be something that would be helpful for you. I'm in Rochester at 585-340-5213. That's 340-5213, or Eric.Lintala at Beltz-Ianni.com. So realistically, you should be able to get the help you need through the exchange, or go right to the insurance company, and they might be able to help you set up on the exchange or buy directly from them if you don't qualify for a tax credit.
Excellent. That was a lot of information, and I hope that we helped you better understand how health insurance will impact you and your family's life. Until next time.
Metro Focus. Inspiring talk news for you.